Minoxidil is one of the most widely used over-the-counter treatments for hair loss. In this video, we'll talk about does minoxidil or Rogaine really work, and is it right for you? The information presented in this video should not be used for diagnosing or treating a health problem. Consult your healthcare provider before making any changes to your health plan. Remember to subscribe to this channel so you can be notified of more pharmacy and medicine related videos. So let's first talk about hair growth. The growth and loss of hair may seem like a simple process, but the hair growth cycle is composed of 4 distinct phases. These stages of hair growth have been studied in great depth to better understand how hair grows and what might be done to prevent or treat premature hair loss. The first 3 phases, anagen, catagen, and telogen, cover the growth and maturation of hair and the activity of the hair follicles that produce individual hairs. During the final or exogen phase, old hair sheds, though usually a new hair is getting ready to take its place. So looking at the picture on the right, let's briefly talk a little bit more about each phase. So anagen, or the growing phase, it's the longest phase, lasting about 3 to 5 years for the hairs on your head, though for some people a single hair could continue growing for 7 or more years. During the anagen phase, your hair follicles are pushing out hairs that will continue to grow until they're cut or until they reach the end of their lifespan and fall out. At any time, about 90% of the hairs on your head are in the anagen phase. The catagen or transition phase starts when the anagen phase ends and tends to last about 10 days or so. During this chapter, hair follicles shrink and hair growth slows. The hair also separates from the bottom of the hair follicle, yet remains in place during the final days of growing. Only about 5% of the hairs on your head are in the catagen phase at any time. Telogen, or the resting phase, typically lasts around 3 months. An estimated 10 to 15% of your scalp hairs are in this phase. Hairs don't grow during the telogen phase, but they don't usually fall out either. The telogen phase is also when new hairs start to form in follicles that have just released hairs during the catagen phase. The exogen phase, or the shedding phase, is essentially an extension or part of the telogen phase. Some experts believe that telogen and exogen are part of the same phase. During the exogen phase, hair is shed from the scalp, often helped along by washing and brushing. Losing 50 to 100 hairs per day during the exogen phase is normal. During the exogen phase, which can last about 2 to 5 months, new hairs are growing in the follicles as old hairs fall away. Each phase has its own timeline, which can be affected by age, nutrition, and overall health. That means there are steps you can take along the way to help ensure that your hair follows a healthy growth cycle. So speak to your healthcare provider about this. So what does minoxidil do for hair growth, and is it right for you? So first, your doctor must determine the cause of your hair loss. So if you have some genetic issue or androgenic issue, minoxidil may not be right for you. Or if you have some inflammatory disorder, that may also be a reason why you probably won't be using minoxidil. So first speak to your doctor and determine what the cause of your hair loss is. Now, minoxidil, how it works is that it prolongs the anagen duration. And we just talked about that a minute ago. That's the growth phase. So thereby prolonging anagen duration, and thereby reducing hair shedding and increasing hair length, increasing fiber diameter, thereby making hair stronger and reducing breakage, and reverses hair miniaturization, thereby increasing hair counts and balding scalp. It does this by increasing the uptake of the amino acid cysteine into the hair bulb, outer roots sheath. Transport of cysteine into hair cortex, keratinocytes, and the emerging anagen fiber is the final step in hair keratinization and the rate limiting step in hair growth. It may also shorten the telogen phase. So I know this is some technical information, but this is what is the proposed mechanism of action of how minoxidil works in regrowing hair. Now, topical over-the-counter formulations of minoxidil, they're available in the trade names Rogaine, Thyroxidil, or other generic names, or you may find it simply by the generic name of minoxidil. It's available as liquid and foam in 2% and 5%. It's effective in about 2 out of 3 men. It's most effective if you're under age 40 and only have recently started to lose your hair. You use it twice a day when your hair is dry. Apply it onto your scalp where the hair has thinned or started to thin. Then be patient. You may notice no changes for 4 months or maybe even more, but continue to take it on a regular basis or apply on a regular basis. What it doesn't do, minoxidil will not cure baldness, and if you stop using it, you will start to lose your hair again. Your hair may fall out faster than before. Some side effects include redness, itching, dryness, flaking, or other scalp irritation, though this is uncommon. Some patients also complain of greasy hair from the application, and the side effects are more common if you use the stronger 5% solution. Now, low-dose oral minoxidil is an off-label use for the tablet formulation of minoxidil, which is approved for severe forms of high blood pressure. And that's how minoxidil was actually found to have properties of hair regrowth, was when patients were taking minoxidil tablets for severe high blood pressure. All of a sudden, they noticed hair growing on the body, including the scalp. So low-dose oral minoxidil may be prescribed off-label by a physician if they determine that this is an appropriate therapy. 2.5 to 5% for men, and 0.25 to 2.5 to 5 milligram tablets for men, and 0.25 to 2.5 milligrams for women, as some studies have shown that women need a lesser dose. The main side effects include hypertrichosis, meaning hair developing in other parts of the body, and lower limb edema. Though topical minoxidil and oral finasteride, or trade name Propecia, is tried first in men. So speak to your healthcare provider, specifically your doctor or dermatologist, and hopefully they can provide the right treatment for you. In addition to minoxidil, there's other supplements out there like biotin that are known to have a positive effect on hair growth. There's laser therapies, and there's of course the hair transplant, which is an option as well. I hope you found this video educational and useful. Please remember to like and share. Thank you.